The epidural is an amazing tool that many women choose to use during labor. One thing that we often forget is that sometimes labor can be really hard when they're administering the epidural. So I want to talk a little bit about how the epidural works when you're in full-blown transitional labor. Um, you're maybe doubled over in pain, or you are in a position, the only position that you feel like you can handle this labor, and all of a sudden they want you to move. Um, all of those kind of things. So the first thing that they do, obviously, when you walk in, is they have you sign a bunch of papers. One of those includes consent for an epidural. So most hospitals will have you sign it, regardless of whether you plan to get one or not. But oftentimes, if they do not, then you will have to sign that paperwork during your labor. So I would highly suggest waiting until after a contraction. If your contractions are right on top of each other, that's one of the things that you're just going to have to do your best to sign that paper and move forward and get through that moment and focus on that moment. So that's consent. They'll ask you, hey, do you want an epidural? You say yes, you sign the paperwork. You usually are wearing their hospital gown and the back is open. So what happens is they call the anesthesiologist. Depending on where they are and what they're doing at the time, it could take a little while. So one thing to be prepared for is that you could have a good 20 to 30-minute wait, and that's a few more contractions to get through before you get the epidural. So plan ahead and have a plan in place for what you're going to do during that time. Don't feel like, I don't prepare that the second you sign that paper, or the second you sign or you say, I want the epidural, somebody's going to be coming in to give you that epidural. Although that would be really nice in a perfect world, it unfortunately doesn't happen very often. So plan ahead, know what you're going to do, how you're going to get through these next contractions, have a steady support system to be able to get through them. And then they'll come in, they'll have you sit really close to the edge of the bed with your back open. They'll find the space where they need to put the epidural. They'll numb you, they'll take care of all of that, and they'll need you to stay really still. So usually what they'll try to do is do it in between contractions, which, like I said before, sometimes isn't necessarily an option, and it can be a really difficult contraction. So plan ahead for that. It's not like super fun to sit still when you're trying to get an epidural during a really difficult contraction. Usually a labor nurse will be there to hold your hand and tell you that it's going okay and that you're doing great. And that can be really reassuring, having a support system there during that time, because it can be very difficult. They'll place the epidural. They will give you a couple of minutes. They'll probably lay you on your side and give you a couple minutes for the epidural to kick in. And then they'll check in on you again. How's everything going? Has it started working for you yet? And then go from there. If it hasn't started working, they'll try to replace it. If they need to, they might turn you over, that kind of thing. But basically what you want is to have, I don't want to say numbness, but I guess a lack of feeling from that spot in your spine down to your feet. So basically it takes the edge off of those contractions as much as possible. So that is how an epidural works during transition.